So I really check my patient's medical record to make sure that I have an order from my physician to insert an NG tube today. I've checked the precautions for my patient, which are universal, so I'm just wearing a mask for COVID. And I've already washed my hands prior to entering the patient's room. I'm going to now enter the room, closing the door and the curtain while I do so, and introduce myself to my patient, tell them about the procedure, and check their ID band. So, good afternoon, Miss Sylvia. My name is Jazzie. I'm going to be your nurse today. I'm going to be inserting an NG tube, which goes in through your nose and into your stomach. It should not be a painful procedure. Maybe a little bit uncomfortable, but we'll take it slow, and if we need to stop for any reason, we'll make sure we do that, okay? First and foremost, can I check your ID band? Okay, can you state your full name and date of birth for me? Perfect. So I've already, as I close the curtains and the door, I've raised the bed up to a nice working height, and I made sure my patient is comfortable. Now I'm just going to drop the headrest, and I'm going to listen to her abdomen. So I'm just going to listen to your abdomen, Miss Sylvia. Normally I would not do it over the sheet, but listen in all 4 quadrants for vowel sounds, which I hear. And then I will just now elevate the head of the bed to about a 45-degree angle, or as much as my patient can tolerate. Now I will perform hair hygiene and put on some clean gloves that I have here. Okay, Miss Sylvia. I have an emesis basin here in case you feel the need to vomit, as well as I have a cup with water. Let me get my supplies together. I'm going to put a waterproof pad right underneath the chin here, just in case any fluids get anywhere you're covered. I'm going to gather up my supplies. I have my lubricant. My pH test. Okay. So now I'm going to now I'm just going to take my NG tube and I'm going to measure it from the tip of the patient's nose that out the way. Tip of the patient's nose to the tip of her ear, and then from her ear down to her abdomen, or where I believe her stomach to be, and I would mark that with tape, which I have here. Okay. Next, I'm going to have her tilt her head up. So, Miss Sylvia, if you can tilt your head up for me, and we're going to close one nostril each, and tell me which one you breathe out of better. Your right one. Okay, that is where we'll be inserting the NG tube today, okay? It just makes it easier for you. I'm going to lubricate the first 1 to 2 inches of the tip of the NG tube. And have her take a deep breath for me and blow out. Alright, tilt your head up, and I'm just going to insert the NG tube in some. If she starts to choke or gag, I would have her open her mouth, and I would use my tongue depressor and a pen light to make sure that it doesn't quell in the back of the throat. Now if I can have you just tilt your head down for me, Miss Sylvia. The patient would be able to tilt her head down, and I would make sure that she is taking sips of water as I advance the tube just when she's swallowing to make sure that it doesn't go into her lungs. Advance the tube, not meeting any resistance. If I met resistance, I'd stop, or if the patient began to turn like a blue or gray color of her lips, I'd make sure that we'd stop and I would remove the tube. Okay, now that we've hit where the tape is, I'm going to loosely secure it to her face. And I'm going to remove some gastric secretions. Here I'm looking for proper placement, so I would remove a few cc's of gastric secretions. I'm looking for a green color with some particles, a dark brown if there was blood there, or a clear kind of brown tea color. Those are all signs of gastric fluids. Then I could either have the doctor order an x-ray, or I could put a little bit on a pH test strip that I have in this basin to check for the acidity, which should be between 0 and 4, which it is. Next, I'm just going to insert some air in and clamp it. And now I'm going to apply a topical skin barrier onto her nose. And I'm going to remove the previous tape that I had. And I'm going to grab a Y-shaped one. And I'm going to place it onto her nose. And I'm going to wrap around and around the tube to hold it into place. Next, I will make sure that the patient turns her head and has enough slack so that I can attach it with a clip and rubber band to her gown. And now I'm going to attach it to the section as well. Making sure that is on. And I'm going to make sure that the blue tube, which is used for venting, remains up. And then I will secure it to her gown. And before doing so, I would measure it with a tape measure. However, I have to do that step. So that is inserting the NG tube. And then to remove it, you would set everything up again. You tell the patient, identify the patient, tell them you're going to be removing it. You would turn off suction, unclip it from her sheet, put that down, and remove the suction. Again, I would aspirate stomach contents to make sure anything that didn't need to be there was gone. And then I can either aspirate with air, or I can use normal saline and take about 10 to 15 milliliters of saline and flush her NG tube. And then once I did that, I can remove my tape. And then just take a deep breath and breathe out through your nose. Out through your nose. And there we go. It's removing the NG tube.